Thank you so much. And I love that part of children because let me say that even if these are children who are older children beyond 2 years,
Yeah.
majority of children will never talk about sexual abuse. Remember, I talked about threat.
Yes.
They are threatened.
Yes.
Remember, they have been wooed.
Mm-hmm.
And if I say, I'll not be getting this gift.
Mm-hmm.
If I say, my dad will not do this to us.
Mm-hmm.
Remember, others have been told the reason you are here and I do this to your mother is because you are close to me. So if you say I will not do, so it's a sarad of so many confusion.
Yeah.
Then there are those children, the young children you've talked about, they don't know what is happening.
Mm-hmm.
They don't know. But in the world of their mind, something bad is happening, but I don't know how to say it.
Yeah.
I don't know how to verbalize it.
Mm-hmm.
And that's why now parents have to be very extra careful.
Yeah.
For example, let's talk about those young children who are 2 years, 3 years. Some of them, and I would say this with a lot of caution. Some of them maybe are dropped in care homes or
Yes.
care schools.
Yes.
That does not mean they are abused,
Yeah.
but it's good to check.
Yes. Mm-hmm.
Because even in those care homes, actually, the caregivers are the people who even call parents and tell parents there's a problem here.
Yes. Yes.
So and because as parents, sometimes we are busy.
Mm.
So this is one of the things that you need to check because there are many things that will always, of course, change. Probably there is difficult when they are going to the toilet. Probably they were a bit hyper and now they have withdrawn. They are not these crying children. Crying is also part of communication
Yes.
to young children.
Yes.
But nowadays they are so crying, they are so clingy. They are clinging to you more than before.
Yes.
It's good to ask yourself, what is this clinging? Sometimes you would drop them to care homes and or kindergartens, and they were very excited. They are no longer excited. Some of even are requesting you to go with them to work. They had this good feeding. They are no longer feeding well.
Yeah.
Or they are not feeding well.
Uh-huh.
They are extra feeding.
Change of appetite.
If there is any change, that's why, but you can only see that change if you're close to the child.
True.
So if you're not close to the child, they'll have difficult even in going to the toilet, both long and short.
Yes.
And they are not telling you.
Yeah.
Some will even start having discharge. When you see that, some parents would tell us, I saw the discharge. I used salt. I don't know what. I mean, before you use all those home remedy, rush to the hospital because you don't know. And I'm not saying that when they start discharging, they have been abused.
Yeah.
But there is a problem.
There is a problem.
There is a problem that you need to take care.
Yeah.
For the older kids who are in school,
Yes.
those 3 years and above,
Yes.
these children, they will talk with signs. And there are million signs and symptoms a parent can know. Let me start with this. This child was not bedwetting.
Please,
All of a
please
sudden,
tell us,
yeah,
Becky.
all of a sudden, the child has started bedwetting. I always tell parents, and Jane, you're a psychologist,
Yes.
bedwetting is a big communication.
Communication, yes.
It's a big communication.
Non-verbal communication.
Yes.
Yes.
It doesn't matter whether the child was abused or not abused. But when they retrogress
Yes.
to bedwetting,
Yes.
they are sending a message.
Yes.
Something has happened into their life. This child was doing well in class.
Yes.
They no longer now perform. You know what we do as parents? We beat them. Before we beat them, let's explore other ways. Could
Yes.
there be a problem? Because they are communicating.
Yes.
This child was hyper. They have now withdrawn. This child now start losing things. Jane will tell us, this better. You've done child psychology.
Yes.
They start forgetting sweaters in school,
Yes.
books, forgetting homework. Those minor things.
Yes.
Is a form of communication. They are telling you there is a problem somewhere.
Yes.
That as a mother or as a father, as a guardian, as what I need to address.
True.
This was child who was not irritable, but now they are very irritable. Irritable, I mean, anything you do to them, they cry, they are rude in school. I remember that, you also did a disclosure. I remember I was going through issues, and my son was also involved.
Yes.
And my son would be the one every time I'm called in school. Oh, he has broken someone's pencil. Oh, he has the book. Oh, he's the one. And in any mistake, he was there.
Yes.
And because I was a psychologist, I had now to wake up and know he's sending a message that he's affected the way I'm affected.
Yes.
And we both need help.
Yes.
And I was, clever enough, and I shared with the teacher.
Yes.
This is what's happening.
Yes.
So allow us to go through therapy, because we both we need. So instead of punishing that child,
Yes.
and they are also growing in homes that have issues.
Yes.
So the way we are affected as an adult, the child is also affected. So what I'm saying is, parents, there are many communication our kids communicate to us,
Yes.
but we ignore.
True.
Because kids communicate through behavior,
Yes.
through actions,
Yes.
and not through verbalizing.
True.
They don't know how to verbalize.
Yes. And on that point, the disclosure that you've talked about, there may be issues that are going on in the family setup or in their friends, and they may not be necessarily rape what we're talking today,
Sure.
but there may be things contributing to what is happening. Probably you'd say something about that.
Sure. We, like I said, partners, marriages are not working. So there is a lot of abuse at home,
Yeah.
And this affects children big time.
Yeah.
Jane, I'm a Sunday school teacher
Okay.
where I go to church.
I was for a long time.
I should retire now. If you retired, then I should retire.
I'm doing now something different. Still on the children. Yeah.
I look at kids when they come to church in the morning.
Yes.
And the way they are behaving, they are very, very angry. And when you sit down with them, they'll tell you stories.
Yes.
Hatujalala, mami na dadi wamelala wakipigana. But it's because I observed a behavior.
Yes.
And kids, and you've said it correctly, that it doesn't matter. It doesn't mean that they have gone through abuse. But our abuses ourselves
Yes.
is affecting our children.
True.
They are going through a lot in school. It's also affecting them.
True.
And that's why we are saying, even as we talk about sexual abuse and sexual violence
Yes.
and all that, that parents need to be extra careful to know what is this that is affecting my child. Because I've said kids talk through actions and behavior. It could be negative behavior or positive behavior. It could be they are seeking for attention.
True.
I tell parents, these kids where every time you're called in school, the reason they are happy because you are called in school to come and see them. That's why they are causing those negative behavior, because no attention at home.
So mommy atakuja,
Of course.
daddy atakuja.
And I'll get attention from teachers and also from my fellow colleagues. So they will do anything negative to make sure that's a psychology of children.
Yeah.
So that is what is happening
That
in
is
the
what
world of abuse, both at home and even themselves when they're abused.
Okay.
Yes.
Still, before we go to the consequences, what are some of the major areas, places that this sexual violence, sexual abuse, defilement is happening? A few of them.
Okay. Now, let's start with children.
Yes.
Happening inside our homes. Nyumbani. Happening inside our friends' houses. You see the bashes that we tell them, they are called bash.
Birthdays, bash, parties.
Birthdays and sleepover.
Sleepovers.
Yes, that's the word I was looking for. The
Yeah.
sleepovers.
Yes.
So it's a nice creature word, nice thing that has come to us as parents. Even when we are seated down and we are telling other parents, my son, my daughter, they have gone for a sleepover.
Yeah.
It looks very nice. It's
Yes.
a cliché, But a lot of abuse have happened there. And I'm not demonizing all those sleepovers. But parents, let's be extra careful. Those bashes and those sleepovers. in our families' houses, you know, when we leave them there. Of course, in public transport, we have seen, even in private transport, it's happening. And I'm also sorry to say, even in churches. So it can happen anywhere.
Yes, yes.
It really can happen anywhere. Sexual violence can happen anywhere and any places.
Yeah.
But let's be careful.
Okay.
And let's talk about it. Now, we were talking about the consequences.
Yes, yes.
I wouldn't like to finish
Before
this.
we are carried away.
Yeah.
Yes, yes.
Wouldn't like to finish this without talking about the consequences.
Yes.
So if we are not able to report within 72 hours, these are the consequences. Of course, there will be the medical part of that.
Yes.
You know, this is where, of course, we get infected with different types of STIs,
Yes.
STDs,
Yes.
of course, unwanted pregnancies.
Yes.
Because, no, not unwanted, unplanned pregnancies. Of course, I'm sure now the other thing is the emotional consequences.
Yes.
And of course, there will also be the loss of livelihood.
True.
Because sometimes people are not even able to work, to concentrate. And because I can't be able to tell the HR or anyone, and I have, of course, because of the emotional torture, I don't perform well, either at school or at workplace. Of course, I'll get a termination. So there will be loss. So there is long term
Yeah.
and short term.
Yes.
And so long term are those, we have seen even death because of breeding
Yes,
and all
yes.
that.
Yeah.
And now the stigma, there is the social isolation. There is now, of course, the livelihood. I mean, even I'm not able to work because remember when abuse was happening, I have hated myself too much that I'm not able to interact with people. Even working becomes difficult. So I'm saying it's a combination of so many things. That's why we need to prevent. By telling people when, that's why we are here, that if it happens, we pray that it doesn't happen.
True.
Rush to the hospital.
Yes.
Take care of your mental well-being. And I know there are people who will say that, but it happened to me. I didn't go to the hospital. Even if it happened to you, we are here.
Yes.
Come for psychological help. You may not have developed any medical complication, but internally, psychologically, it's damaged.
Yes.
That is why such stations are open so that we can reach to millions and tell them, in this facility, we have professional counselors
Yes.
who can help.
Yes.
And probably we are speaking to people who are there saying it happened. We are open for help. We have many professional counselors
Yes,
who
true.
can help.
Yeah.
We talked about young children and pornography, masturbation, and that is a sickness. Addiction is sickness.
Yes.
Again, we are here, even as this station, to tell you we can help you without judging you.
Yes.
Because if you let it go again and the addiction, it will lead to other addictions. Come for help. The help. And
there's
I'm
help.
sure Jen will talk about that help.
Yes.
You'll tell us whether you charge
Yeah.
or whether you'll tell us about that help.
I will.
Yeah.
Yeah.
So we are saying out there, whether sexual violence happened long time ago and you're there, it's eating up, help is available.
Yes.
Come, don't shy away and say, because Becky talked of 72 hours. No, that is because of medical part and evidence, but still psychological help is open.
Probably our viewer is saying, mine happened long time ago. I was raped 10 years ago. But there is what you are talking about, some of the symptoms that I've been seeing, withdrawal and all that. Can I still seek help after 10 years?
Even after, no, it can haunt you even after 20 years.
Yes.
Even after 30 years, it still can haunt you.
Yeah.
Come for help. Those are what we call the childhood traumas that affect you now in your adult life.
Yes.
Help is available.
Yes.
And yes, you can come for help and it's doable. You can be helped.
Okay.
Yeah.
Any other consequence that you can remember?
Yes, one, I would have gone without talking about this. Some of the ladies, let me talk to the ladies who have been raped and they have given birth,
Okay.
majority of them tend to hate those children
Mm-hmm.
because remember, they see them and they see the pain they went through. Actually, they equate the children with the pain, with the torture, and they reject them. Actually, they reject them when they are still unborn. Now, these children, again, they know that. Still, we can help even those children and even help those ladies so that they're able to forgive themselves and accept those children. And we have seen now a series of rejection that is going because I rejected myself, I rejected the baby has rejected. And the other consequence now in that line is if you are raped once, sometimes, not helped, sometimes you become vulnerable and you can find yourself into series of rape.
Yes.
And you find someone who was raped when they were young, when they're adolescents, they are raped, when they're adult, they are raped.
Mm-hmm.
Because we say it attracts. And that's why we are saying you need help so that we break that chain.
Yes.
I know in Christianity you call it, I don't know what, but for us, you take through psychological help
Yeah.
so that you're able to break that.
You walk with them in the journey.
Yes.
Yes.
Mm.
Okay.
Yes.
Wow. We know that this loss has a lot of issues, both legal and psychological, emotional, and all that. Probably you would say, okay, you know, you are not a lawyer, you're a psychologist like I am, but you can say something small about the legal part of it, because we talked about the evidence that we collected. So what happens and how can somebody seek redress?
Okay. This is what happens. And that's why we are saying within 72 hours, it's very easy to seek readdress. Because what happens, justice starts with you
Yes.
because you carry something that we call the live evidence.
Yes.
You now as a survivor.
Yes.
Then from there, you go to the hospital.
Yes.
So we correct the samples. You know?
Yeah.
So we have the live evidence.
Yes.
Your live evidence, once we document it we document it in a RIGO. There is a RIGO tool.
Yes.
It's called post-lap care form.
Yes.
So that is where it's documented. And that is a tool that will be taken to court.
Yes.
That is a tool that now, us as health facilities, us as practitioners, that we go to defend you in court. Actually, I'm always in court.
Yes.
Defending using that tool.
Yes.
But you see, that tool is a live tool.
Yeah.
That's why you have to come within, we have to fill it within 72 hours because it tells us what has happened. That tool has two parts.
Okay.
The medical part and the psychological part.
Yes.
That is what we call MSc, mental status exam.
Yes.
So that is why I as a psychologist, I'll feel your mental status, which is admissible in the court of law. So that tool again is used by the police.
Yeah.
And that is what now they use at court. So for you to get good justice, it's good to come within the 72 hours. The facility will help you.
Yes.
Yeah. So you can get justice. And the good thing is, like we can celebrate yesterday, the CJ, Madam Kome have given a whole court for sexual violence. That now, what we do, we've been going to other courts, but now there will be a court for only that. So cases will be fast-tracked.
Yeah.
Yeah. So as you're going to court, you're also taken through psychological support so that you are able also, you are given, and it's free again.
Yeah.
There are pro bono lawyers who will help you. And again, the government, through the ODPP, they also help you through the government lawyers.
Yeah.
So you shouldn't fear.
Yeah.
There is all help
Yes.
that is out there
Yeah.
that will help you. Sometimes I know it has been a wrong process, but since things have changed,
Yeah.
I can attest things have changed,
Yeah.
and we are seeing justice for survivors.
Yes.
Yeah.
Thank you.
You're welcome.
Let's look at another very important area. How do we support these people in the community? How do we support the survivors? They've gone through the 10 months. How do we support them? They are now with us, integrated with us. How can we support them?
So that's another program, because now again, when I go out there, remember I left people who knew
Yes.
I was raped.
Yes.
And so they are labeling me. So they take me back the trauma. So I relapse. Even so I don't know. I know there are many programs I've seen together with what we do. We go out, we call it the reintegration program.
Yes.
This is where now again we educate the community
Yes.
that we should not put shame on survivors. We should shout more on the perpetrators and around. And one of the thing within the 10 months is to empower the survivor, that when you go out there, you need to be very strong. Because the community may look at you as the person who was raped.
So you empower them.
So we empower them so that they can stand strong, so that they are able to, to swim through the storms of the community.
True.
So for us, because this is the identified patient, the IP, we don't have the community with us.
Yeah.
So this, as we do the 10-month program, we help this survivor that this is what you may expect when you get there. And majority of them have become ambassadors, sharing their stories and helping others.
Yeah.
So, when you share more, people don't victimize you. What they do, they want to run from you.
Yes.
But we also tell the community, because I know we have people who are watching, that we should stop, stigmatizing them. We should accept them and not blame them for what happened. But we look at the perpetrator as the wrong one, as a person who is the evil, not me who have been sexually violated.
Yes.
Yeah.
I'm just tempted to ask this question for the benefit of our viewers. Is it residential, the 10 months, is it residential or is it non-residential? So that if it is, kindly tell us.
No, it's a non-residential program.
Yeah.
But of course, we have ways on how we facilitate you so that you are able to be in that program.
Okay.
So it's within where you see Nairobi Women's is where you can ask about that program.
Okay.
But it's again divided for children, for adolescents, for senior citizens.
Yeah.
And so we look at where you fit, but of course you have to be a survivor of sexual violence.
Okay.
Yeah.
There is one area that we are just about to forget, and I can't let you go before we talk about people with special needs, people with disabilities. Probably this person cannot see, this person cannot hear. Now, how do we address or how do we support them when they are this with special needs?
Yeah, unfortunately, would have forgotten that. And that's a critical part, because people who have been enabled differently, they have really been taken advantage of. I know, especially people who are maybe in wheelchairs, the people who are aiding them are even violating them. We have children who cannot even see, and people are taking advantage of them. Again, we call them special need, class of people that really need a lot of help. And we have help all over. Where I work, I know we really help them, because we have different professionals who are trained to help people who are enabled differently. Even in government facilities.
Yes.
I'm talking about this because I've been involved in many policies, pushing for policies and training healthcare providers in different government. And I can tell you, we have professionals who have been trained to support the special need class.
Yeah.
So, and again, we need to tell parents that we also need to take care of them, because children who are enabled different, they are violated, but because they don't know how to express themselves, they keep quiet. So it's us as caregivers they also communicate in their own way when they are going through pain and emotional challenge. They also communicate through that non-verbally. So when parents see that, they also need to rush them to the hospital. There is a special place for them, and there is actually people have been trained on how to handle them. Those who can't see, those who can't walk, and those who are mentally challenged, and the people have really taken advantage of them, and there is help for them.
Thank you so much.
You're welcome, Jane.
Becky, what is your parting shot?
My parting shot is speak out. Don't keep quiet. When you speak out, you're helped. And you know, when you're helped, it's for your own benefit. Forget about what other people will say. Just speak out, look for someone to share with, and to the parents, be close to your children. Now schools are closed. Just be available for them. Know what happened in school. Some were molested in school, but they can't talk to you because you're like a policeman in the house. Be warm. Open your ears and your heart. Listen to them. Find help for them. And even those who were sexually violated long time ago and they are walking with shame and guilt. Don't walk with shame and guilt. Come for help. It's available.